I'm Nimalan Maruthainar. I'm one of the orthopaedic and trauma consultants here at the Hospital of St John St Elizabeth. I've been here since 2005, and probably the majority of my elective planned work and consultations, it relates to hip and knee pathology. A knee replacement is designed to help someone who has a painful and osteoarthritic knee that hasn't responded to other treatment options. Treatment options being simple lifestyle measures, maintaining a healthy weight and healthy diet, physiotherapy, perhaps injections, simple painkillers. And if all of those have failed to effect an improvement, then the patient's appropriate to have a total knee replacement. So knee replacement is actually one of the best operations for improving patients' quality of life across the whole of medicine. The idea is by taking away someone's pain from their knee, they're then able to function better, perhaps walk farther, sleep more comfortably, and just manage the daily things of life more readily. One of the great pluses of practicing here at Hospital of St John and St Elizabeth is that we have got an excellent team of people delivering care. We've got expert nurses, very skilled physiotherapists, and a fantastic nursing team in the operating theatres. We've got state-of-the-art imaging facilities and indeed brand new operating theatres with some of the best facilities around. And perhaps one of the other great advantages is that knowing that the profits from what we do here goes into funding the hospital's charity, the hospice. Our hospice treats over 4,000 patients a year. It is non-fee paying so far as our patients are concerned, and uniquely it actually offers care not just to people in their very terminal stages, but actually offers patients with more of a long-term terminal diagnosis. So that's something of a unique thing amongst hospices in general.